right, so I'm going to pick up with sequela is singular, sequelae or sequelae, either pronunciation is plural. So this is also known as a late effect. So this is a residual or a current issue or problem based on something that occurred previously but has resolved or healed. So there's no really time limit, but you can't use a sequela code if the original condition is ongoing. So some terminology you may see would be old or previous, caused by previous. Some terms such as malunion or non-union, this would be for a fracture. So if we have a non-union or malunion, we don't have the fracture. The fracture has healed just incorrectly. So we're going to code that with two codes typically. One for the current condition, and that goes first, and then a second code as a sequela code, so under your S's in your index for that original condition. However, there are some codes where the seventh character would indicate sequela. So, for example, malunion in particular, when you look that up, the seventh digit has a sequela code, an S for the seventh digit that would indicate that. So that one you only need one code. But for others, for example, maybe ongoing condition from CVA, cerebrovascular accident or stroke, they're not currently having the stroke, so we don't code the stroke, we code the sequela of that. And we'll get into that more as we get into the individual chapters in our tabular list. So typically we would have two codes, one for the condition or nature, and that's the residual effect, the ongoing thing, and then a second one for the sequela of the original condition. Now, of course, there are always exceptions. So one of the things that you may see would be the conditions dealing with the pregnancy or puerperium period, which is the 6 weeks following childbirth. So there are some specific instructions, directions when we get into the sequela codes for this situation and also for cerebral vascular diseases. So again, use your coding manual, your index, read all the information to assign these codes, but you have to know this exists for you to be able to code it correctly. So when you're coding for a sequelae or sequelae, plural, you're going to code the original, the current condition, the residual effect, followed by the sequela code. And again, you find that not under the initial condition or problem that has healed. We never code that once it has healed, but we code the sequela code, which you find under the S's in your index. Impending or threatened condition. So this is something that would be indicated at a discharge. So that indicates a inpatient type of condition. So if the threatened or impending condition did occur, you're going to code that as a normal condition or diagnosis. If it did not, then what you're going to do is look in the index for a subterm for that initial condition. And so if your subterm under your main heading of the original condition has an impending or a threatened option, you can use that code, or there are some codes under the I's for impending or the T's for threatened, so you can look under that and use those codes if you verify them and they're applicable. And if you don't have that, then we code just the underlying conditions and not the threatened or impending condition. So one example of this might be pregnancy. Under pregnancy, the subterm complicated by, you can find threatened, abortion. You can also find some codes under the T's for threatened or under the I's for impending if we have this situation. Okay, we can only report one specific diagnostic code for each encounter. So if you have something like a bilateral condition and they're looking at both the left and the right, and there's not a code that indicates left or right, you just code that one code one time. Okay. Now there are some codes, for example, the ureteral calculus on the left and right. So you only code that once, but there are some codes that have a distinction for left and right. So if you had that bilateral condition, you would code one for the left, one for the right. So this the left and right deals with the laterality. Okay, so there are some codes that indicate left or right, and if they have a left or right in the coding manual, your documentation does not indicate whether it was left or right. We're going to choose the unspecified code. And then if we have, there are some that will have a bilateral code, and if they do not, and you have both the left and the right, you're going to code for the left and the right. So that would be 2 codes. So documentation for the BMI, body mass index, and pressure ulcer stages. These can be coded. These can be documented by a clinician versus the actual doctor. So if you have a nurse that indicates one of these, you can use that information for your coding. It doesn't have to come specifically from the doctor for these 2 incidences. However, an associated diagnosis would have to be provided by the actual provider. And just a note to you that the BMI codes should only be reported as secondary diagnoses, and there are rules about when to include secondary diagnoses, so you need to make sure you look at that. This is dealing with secondary diagnoses in the, I believe it's the Section 3 guidelines. So if you look at that, it's on page 43 in your textbook. But do remember that all of your guidelines that you see in your textbook are also in your manual. And actually, I believe page 43 is in your manual. So if you look at that, that has that information on when you can or should include a secondary diagnosis. Complications of care. Oftentimes this also deals with inpatient. So the provider has to indicate that there is a definite relationship between the condition going on that would indicate a complication. Just because you have 2 conditions, or if you have a condition after a procedure or service is rendered, it does not necessarily mean it is a complication of the original. So you have to watch your documentation, and that has to be indicated by the actual doctor. Sometimes it may just mean 2 separate codes instead of looking at a complication. Syndromes. If you're looking at syndromes, you're going to look in the index, and when it says follow the index guidance for coding, if your index indicates a code, you go look at that, and there's nothing that says you cannot use that, then you're going to go ahead and use that code. If you don't have anything in the index under these syndromes, you're going to look at the manifestations and code those. Everything that a doctor may document as a syndrome may not be a syndrome in the coding manual. In that case, you use the manifestations. So what this really means is if you were looking under syndrome for inappropriate, so it's a subterm under the eyes, secretion of antidiuretic hormone, it gives you the code E22.2. So if you go and verify that in your tabular list, what that is going to tell you is that it is a hyper function of this hormone, or a hypersecretion. So even though inappropriate doesn't indicate specifically hyper, your index is telling you this is the code, and so you're going to use that hyper code for the E22.1 when you go to the tabular and verify that.